Hi everyone. Today I am going to discuss about occupational health service. I am M. Sasi, working as an assistant professor in Tribhuvan College of Nursing. Objectives: the students is able to define occupational health, explain goals of occupational health, enlist objectives of occupational health, narrate the advantages of occupational health, enumerate hazards of occupational health, enlist preventive measures in occupational hazards. These are the objectives. At the end of the session, the student has to learn. Introduction. The primary concern of occupational health services remain those specified by the ILO or WHO. ILO is nothing but the International Labour Organization in 1950, although work-related diseases are now considered as well as purely occupational diseases. The actual services offered are essentially preventive in nature. Occupational healthcare refers to services that assist the employers, workers or their representatives to ensure that the workplace is safe and healthy according to accepted occupational safety and health guidelines and requirements. Occupational health is the health science which is related to human work, workplace and work environment. Occupational health is entirely preventive medicine. The chief objectives of occupational health is the safety of workers in all occupations from injuries and diseases and to improve their health status. Occupational health science gives priority to the welfare of the workers. Through health protections and promotions, the efficiency of workers can be improved, thus more work and productions can be achieved, absenteeism can be checked and better relationship can be established. Definition. According to Joint International Labour Organization Committee on Occupational Health 1950 defined occupational health as the highest degree of physical, mental and social well-being of workers in all occupations. Goals: to reduce industrial accidents, to prevent occupational hazards or disease, to achieve maximum human efficiency and machine efficiency, to reduce sick absenteeism. Objectives of occupational health: to maintain and promote the physical, mental well-being of the workers, to prevent occupational disease and injuries, to adapt the workplace and work environment to the needs of the workers, and application of economic principle. It should be preventive rather than curative. Advantages of occupational healthcare: investigates and assesses load factors and hazards and gives expert assistance for eliminating them. Gives information and advice. Estimates employees' working ability and monitors their health condition. By its knowledge and skill support action for maintaining working ability in the development of individual, working environment and working community. Occupational hazards. We have different kind of occupational hazards. We'll see one by one. The first one is physical hazard. Under the physical hazard, we have heat and cold, light, noise, vibration, ultraviolet radiation, ionizing radiation. Heat. The direct effects are burns, heat exhaustion, heat stroke, heat cramps. The indirect effects are decreased efficiency, increased fatigue, enhanced accident rate. Usually, the direct effects will happen when the person is exposed with the sunlight. Cold. When exposed to the excessive cold, the person may develop the chilblains, erythrocyanosis, immersion of food, a frostbite as a result of cutaneous vasoconstriction, general hypothermia. You can see in the picture, the fingers are become very necrosis. Sometimes when they exposed with the excessive cold, they may develop this kind of issues. Light. The acute effects of poor illumination. Due to that, the person may develop the eye strain, headache, eye pain, eye fatigue, lacrimation, congestion around the cornea. The chronic effects on health include minor nystagmus. Coming to the noise, because of the noise exposure, excessive noise exposure, the person may develop the auditory effects and non-auditory effects. Under the auditory effects, the person may develop the temporary or permanent hearing loss. Under the non-auditory effects, nervousness, fatigue, interference with the communication by speech, decreased efficiency, annoyance. Occupational hazards. Due to the occupational hazards of vibration, exposure with vibration may also produce injuries of the joints of the hands, elbows and shoulders. And exposing with ultraviolet radiation, due to that the person may develop the conjunctivitis, keratitis, is otherwise called as a welder's flash. Usually in the welding field they used to get this kind of issues. Ionizing radiation, they expose with the radiation that leads to genetic changes, malformation, cancer. And they may develop the leukemia also, depletion, ulceration, sterility. In extreme cases, death also may happen. Ionizing radiation, the International Commission of Radiological Protection has set the maximum permissible level of occupational exposure at 5 rem per year to the whole body. Then we are going to discuss about the chemical hazards. Under the chemical hazards, we have local action and inhalation. Under the local action, the person may develop the dermatitis, eczema, ulcers, cancer by primary irritant action. Inhalation, they can inhale by dust also, by gases, metals and other compounds also they can inhale. We will see one by one. Dust are finely divided solid particles, the size ranging from 0.1 to 150 microns. Dust particles larger than 10 microns settle down from the air rapidly, indefinitely. Particles more than 5 microns are directly inhaled into the lungs and are retained there, and it is mainly responsible for pneumoconiasis. Gases. We have different kind of gases. The first one is simple gases, asphyxiating gases, anesthetic gases. Simple gases, when they take more the prescribed amount like oxygen, and when they take hydrogen, then they will develop some of the complications. The next one is asphyxiating gases, carbon monoxide, cyanide gas, sulfur dioxide, chlorine. And anesthetic gases, chloroform, ether, trichloroethylene. Then coming to the chemical hazards, metals and their compounds, lead, antimony, arsenic, beryllium, cadmium, cobalt, manganese, mercury, phosphorus, chromium, zinc and others. Ingestion. Occupational disease may also result from ingestion of chemical substances such as lead, mercury, arsenic, zinc, chromium, cadmium, phosphorus. That these things can be ingested. Due to that, the person may develop the complication. Biological hazards. Due to the exposure with the bacteria, viruses, fungus, the person may develop different kind of diseases like brucellosis, leptospirosis, anthrax, hydatidosis, tetanus, encephalitis, fungal infections. And psychosocial hazards. Some of the factors which will be affecting the health are frustration, lack of job satisfaction, insecurity, poor human relationship, emotional tension. Prevention of occupational disease. We have different measures that will be helping the employees to prevent the complication. First one is medical measures. Under the medical measures, we have components like pre-placement examination, periodical examination, medical and healthcare services, notification, supervision of working environment, maintenance and analysis of records, health education and counseling. Pre-placement examination, in that before we are putting the employee into the job, we are just examining the person whether the person is fit for the particular job. That is called economics. The next one is periodical examination. According to the policy and protocol, every 6 months or 1 year we have to examine the employee. Medical and healthcare services, whatever the health services the person is needed, the services has to be given to the employee. Notification. Under the notification, we have list of diseases that should be notified. Due to the particular industrial or occupational area, the person may develop the issues. So that has to be notified and that has to be taken care. And next one is supervision of working environment, where the employee is working, all things like start from the humidity, noise, climate, everything has to be taken care. Maintenance analysis of record. The person record, health record has to be maintained. Their health status has to be updated in the record. That has to be maintained properly. Health education and counseling, where whatever the employee is needed, the particular kind of health education has to be given to the employee. Coming to the engineering measures, design of building, good housekeeping, general ventilation, mechanization and substitution. Design of building is once the industrial area or plant is already constructed, we cannot rebuild and reconstruct. So before we are constructing, we have to plan properly, we have to construct it. And good housekeeping every time, every day and every time the area has to be kept clean. General ventilation, they should have the adequate proper cross ventilation they should have. Otherwise the person may develop the respiratory issues. Then coming to the mechanization, wherever we can use the machine instead of human being, there they can use the machine. That is called as the mechanization. Substitution, instead of using harmful material, they can use the less harmful material. Prevention of occupational disease. One is legislation. Under the legislation, we have two factors. First one is the Factory Act 1948, the Employee State Insurance Act 1948. The scope for purpose of the Act, a factory means an establishment in which 10 or more workers have been employed during the preceding 12 months in a manufacturing process, operated on power, or in which 20 or more workers have been employed during the preceding 12 months in manufacturing process without power. Employee State Insurance Act 1948, under this the employee can get the different types of benefits like medical benefit, sickness benefit, maternity benefit, disablement benefit, dependent benefit, funeral expenses and rehabilitation allowances. We'll see about the occupational health teams. We have few members like occupational health nurse, physiotherapist, specialist doctors, industrial managers, supervisors, shift in charge, rehabilitation specialist, labor welfare officer, labor union representatives, representative voluntary organization, other invited members as per the need. Conclusion, occupational disease should not be neglected and should give proper attention at time. It is the main role of the nurse to work as an educator and protector in the field of occupation. Early detection and timely management can control occupational diseases. So, I hope you understood my presentation and use this knowledge in occupational area. Refer the Park book and I have referred the net also. Thank you for watching my video. Thank you once again. Thank you all.